You and your friend started a GLP-1 at the same time. She's a little bit younger than you, and she seems to be getting results faster with a lot less effort. You, on the other hand, are getting your protein in, doing everything right, drinking your water, doing resistance training, and it just seems harder. Here's a newsflash for you. It may just be harder for you. Not because you're doing anything wrong, but because the biological environment in your body is just different. And once you understand why, you can go through the journey with a lot less struggle. Welcome to Off Label with Fallon G, the NP. If you're new here, welcome. If you're not new, welcome back. I'm Fallon, a dual board certified nurse practitioner. I am a post-bariatric patient after having a VSG procedure over 10 years ago, dealing with some weight regain. I am on a GLP-1 journey with Mounjaro, and I'm smack dab in the middle of perimenopause. Today I'm going deep on the specific reason why the journey may seem harder on a GLP-1 when you have a perimenopausal body. The estrogen connection that most providers never explain. And I'm giving you 5 specific things that you can do about each part of it. The content in this video is for educational purposes only and does not constitute medical advice. I am not your provider. Please speak with your medical provider before making any changes to your medications, your health regimen, or your exercise program. Let's get into it. Now let me start with the most important piece, the direct connection between how estrogen and a GLP-1 medication works in your body. Most people think of GLP-1s and hormones as 2 separate topics. Your GLP-1 medication and your estrogen, 2 different conversations. They are not. They are deeply connected. Here's how I want you to think about it. Your GLP-1 medication works by finding special receptor sites in your brain and your gut. Think of those receptor sites as doors. Think of the medication as the key. When the key finds the door, it opens it. Appetite goes down, blood sugar improves, and your metabolism gets a signal. Now here's what most providers don't tell you. Estrogen creates more of these doors. When your estrogen is healthy, stable, not fluctuating, your body makes more GLP-1 receptor sites, more doors for the medication to open. That means the medication can work more powerfully. When estrogen drops and starts to fluctuate in perimenopause and menopause, there are fewer doors to open. The medication has not changed. The dose has not changed, but there are fewer places for it to work. So the effect can feel smaller or slower. This is one of the main reasons why a GLP-1 medication works differently in a perimenopausal body. The medication is working, but it has a little less to work with than someone who's not in this stage of life. A 2025 research study confirmed that estradiol, the main form of estrogen, directly increases GLP-1 receptor expression in the gut and the brain. More estrogen means more receptor sites. A January 2026 Mayo Clinic study of 400 postmenopausal women confirmed measurably different GLP-1 outcomes based on hormonal status. Women on hormone replacement therapy alongside a GLP-1 had results closer to what younger women achieved in the original clinical trial. In practice, if a patient tells you she's doing everything correctly and still not getting the results that she's expected, hormonal status is often a logical place to look. Not the dose first, not the diet first, the hormone picture, the number of doors that are available for her to use. This is why I personally consider hormonal status as a core part of every GLP-1 conversation with women, especially in midlife. It's not a side note conversation, but it can be the core of having a good experience with the medication or a not so good experience with it. Beyond the receptor relationship, there are 4 specific things perimenopause can do that can compound the challenge. Each one makes a GLP-1 harder to work with, and all 4 of them can interact. The first thing that can happen is insulin resistance, and we've discussed this extensively in episode 1. So go back and watch that if you have. Estrogen helps your cells respond to insulin properly. When estrogen drops, the cells become less resistant. The body then has to produce more insulin to get results. This makes your blood sugar less stable, promotes that belly fat storage, right? Start to gain weight in the midsection, and it makes it harder to lose weight, even when nothing in your diet has changed. Now, the second thing that happens is fat starts to move to the belly. We talked about this as well, how it starts to go from the hip and the thigh and go into the belly, around the organ, creating that highly inflammatory and metabolically active visceral fat, remember, is more dangerous than that subcutaneous. Subcutaneous means it's just in other parts, your arms, your legs, those types, because it produces inflammation, it worsens the insulin resistance, which makes this type of fat harder to lose. Now, the GLP-1 medication targets this type of fat specifically, which is one of the medication's biggest advantages, especially for midlife women. The third thing that happens is that our muscles start to disappear. Estrogen supports muscle. When it drops, the muscle loss that we're experiencing speeds up. Less muscle means a slower metabolism. You see how this is just a cycle? Now, this is where we have to be careful, because taking a GLP-1 means that because you have the appetite suppression, you're not eating as much food, which can decrease your protein, which can make the muscle loss more accelerated. So without intentional protein intake and resistance training, the medication accelerates this process. The fourth thing that happens is sleep is affected, and that cortisol. Night sweats and hormonal changes can break up our broken sleep raises your cortisol, which is your stress. Cortisol drives what? Insulin resistance. See? It all works together. This increases your hunger. This reduces your fullness signal. And it can directly blunt the GLP-1 effect. So a bad week of sleep can result in stall. And this is not because the medication isn't working. It's just that it's fighting against cortisol. These four factors do not happen in isolation. They feed on each other. Insulin resistance promotes the visceral. Visceral fat worsens insulin resistance. Muscle slows metabolism. Broken sleep raises the cortisol. And this makes everything worse. So a woman in midlife may have slower responses to a GLP-1 medication. It's not one culprit that's affecting this. It's a combination of all four of these. It's important to know what's going on because the intervention for each one can be different. In my own journey, I started to get frustrated because I knew that people, especially being a VSG, that many people lost 2 pounds a week, 1.5 pounds a week, and they had this consistent weight loss, 10, 11 pounds in a month. Well, how is this happening? Surely this could happen to me. I already have a smaller stomach because I'm a VSG patient, and I'm hitting my protein goals, I'm drinking the water, I'm doing everything I need to do. Why does it feel like I'm not losing as fast? Then I looked at my own picture. You are perimenopausal woman. Your sleep is crap because you tend to stay up late at night. I work late hours, charting, finishing my charts for the day, getting all the administrative duties done for my practice. So my sleep wasn't the best. I started to change my sleep pattern to go to bed at 11:30, at least by 11, drink more water, continue my resistance training. And do you know what happened? I didn't start to lose faster, but I was more consistent. So now I'm consistently losing 1.2 pounds a week on my journey. And I have accepted that that is stable, normal weight, especially for a woman in my condition. Perimenopausal, going through all the hormone changes and fluctuations, I have to have grace. And that is what I want you to understand, is that it is okay to be slower than what you think as long as you're within that normal. Now here's the part that matters, what you can actually do. And I have 5 specific interventions. The first thing you can do is get your hormones tested. Now understand, getting your hormone levels tested aren't the end all be all, because your hormones fluctuate all throughout the day. And so it's just giving you a snapshot when you get your hormone levels tested. However, it's important to talk with your provider about symptoms. Are you having trouble sleeping, night sweat, mood changes? Are you starting to gain weight in the midsection that you can't get rid of? Are you exercising and eating correctly, but nothing is budging? The weight isn't coming off, nothing's changing. Your body seems to be changing in a way that it has never been before. You're having more fat in the middle of your body. You're noticing skin changes or just body changes that you haven't noticed before. Talk to your provider about this. This can determine, okay, are you in that dipped over into the pond of perimenopause? Are you now more menopausal? Has your estrogen level dropped? That is the most important, right? Because if the estrogen is dropping, then we know that you're more at risk to losing muscle, you're more at risk to developing that visceral fat, your cardiovascular and your metabolic numbers are going to go up or trend in a negative direction. Have the hormone replacement therapy come, not as a decision that you have to make today, but as a conversation that you deserve to have with full information. Ask your provider about your relationship between estrogen and a GLP-1 medication. The third thing you can do is make sure you hit the 25 grams of protein in every meal. Not 25 grams a day, but 25 grams for every meal. There's going to be a video coming later in the series where I'm going to hit on this particularly and give some really easy meal ideas, some quick snack ideas, so that this is not a struggle and that you'll know how to prepare yourself and what to have available that you can reach. This 25 gram to 30 gram goal is the threshold that triggers muscle building at each sitting. In a body where muscle loss is accelerating and the GLP-1 is suppressing the appetite, intentional protein in every meal is non-negotiable, and it is the most important nutritional decision that you will. Then protect your sleep like it is a prescription, because it is. Have a consistent wake-up time. Cut the phone off 60 minutes before bed. Maybe use a magnesium supplement 200 to 400 milligrams of magnesium glycinate. Talk with your provider before starting any. Maybe think about cooling measures at night to prevent night sweat. Having a cool room, a cooling pillow. They make those really good cooling pillows. And some moisture wicking linen or bedding. Better sleep is going to reduce your cortisol. Lower cortisol means better insulin sensitivity. Better insulin sensitivity means your GLP-1 medication can work. And then the last thing is get a full thyroid panel. I talk about this over and over and over again. Guys, you know this is a soapbox. Get the full picture. Thyroid stimulating hormone, free T3 and free T4. This is going to tell you where your hormones. Get the full panel. Perimenopause impairs the conversion of T4 to T3. T3 is the active thyroid hormone. GLP-1's calorie restriction can compound this. Low T3 puts a ceiling on your metabolism that no GLP-1 medication can break through. Ask specifically for these lab values alongside your thyroid stimulating hormone. Again, the full picture requires all three so you can address it so that you can get a better outcome from your medication. GLP-1 is not less effective in perimenopause. It is effective in a more complicated environment, and it needs more support to do its best work. The medication is doing its job. Your task is to address the environment that it's working in. Hormones, sleep, protein, thyroid. These are the variables can affect how much of the GLP-1's potential your body can access. So drop a comment below. Which one of the 4 factors do you think is affecting your results most right now? I want to know. And if you want your specific hormone picture, your labs, and your GLP-1 response review together, that is what the Clarity Consult is for. It is for that exact conversation. There's a link in the description below if you're interested in that. Thank you for watching. Take care of yourselves. I'll see you in the next episode.